Hello and welcome to Take Your Medicine. Today's show, we deal with something that we all have suffered with at one point in our lives. Today, we talk about coughs. Now, there are different types of coughs that we may have, and it's important to understand which cough we have so that we can treat it with the correct medication. Coughing is a natural reaction by the body to expel fluid or foreign bodies from the lungs. It is also a reaction to irritation of the respiratory system, such as a tickle in the throat or a postnasal drip. It may not have occurred to you that different causes produce different coughs. The dry cough from a dusty room is different from a wet cough that results from a cold or flu infection. Here are some different coughs and ways to recognize them and what they mean. The first cough we'll look at is a dry cough. A dry, hacking cough is a cough that is non-productive. This means you do not produce any phlegm or mucus as you cough. Dry coughs can be caused by a variety of different conditions, including irritation, such as a tickle in the throat may be caused by an actual foreign body in the nose, throat, or lungs. For example, inhaling dust, pollutants, or chemical vapors in the air can trigger a dry sounding cough reflex to expel the irritant from the lungs. Next, we have dry respiratory tissue, and here we have your throat or lungs drying out due to cold air, dry air, dehydration, tobacco smoke, or low mucus production. This causes it to become irritated, and this irritation may produce a dry cough. The next cause could be inflammation, and in the throat and lungs, when they become inflamed either from bacterial or viral infection, or physical strain or environmental conditions. So an example of this is after you recover from a cold or flu, your mucus production may have returned to normal, but inflammation in the lungs and throat may produce a dry post-viral cough. Similarly, overuse of your voice, common in sports spectators, singers and stage performers, may strain your throat causing inflammation and a dry cough. Likewise, asthma triggers can cause an asthma attack that includes inflammation of the lungs and a dry cough. Another cause of a dry cough could be some forms of medication. An example of this is an ACE inhibitor used to treat high blood pressure. This can cause a dry, irritating cough. Treatment of a dry cough depends on the underlying cause. Sometimes a drink of water, a throat lozenge or humidifier can reduce the irritation and rehydrate the tissues and resolve the cough. Cough suppressants can help to calm the brain's cough reflex. For mild inflammation, rest and avoidance of any triggers can help the body heal, thereby eliminating the cause for the cough. However, for severe inflammation, such as in serious asthma attack, examination and treatment by doctors at a private practice or a hospital may be necessary to avoid any complications. The next cough we'll look at is a wet cough. A wet cough is also referred to as a chesty cough. A wet cough sounds loud and heavy, and these coughs are also referred to as a productive cough because they produce mucus. These coughs are in fact the body's attempt to expel the mucus from the lungs. There are many possible causes for excess mucus, including chest congestion from a cold or flu, pneumonia, or allergies. Although many people complain of the flu every year, most cases of the flu are actually colds. Treatment of a wet cough is usually part of treating the underlying cause for the cough. That is, reducing the mucus will reduce the cough. As part of this treatment, you can use expectorants to loosen and hydrate the mucus so that it's more easily coughed up by the body. A humidifier can also moisten the mucus and make wet coughs more productive, thereby reducing the mucus in the lungs. Most doctors do not recommend using cough suppressants for wet coughs because they merely suppress the brain's cough reflex, so the mucus remains inside the lung rather than being coughed up. The mucus sitting in the lungs can lead to infections and pneumonia in extreme cases. The next cough we look at is a whooping cough. A whooping cough is a violent cough that causes the lungs to expel so much oxygen that you gasp or whoop between coughs. Whooping cough is characteristic of pertussis, which is a bacterial infection, and a whooping cough has become the common name for this disease. However, other conditions can also cause a whooping cough, such as pneumonia, severe asthma attacks, emphysema, chronic obstructive pulmonary disease, and tuberculosis. Most of the causes of a whooping cough are serious enough to justify an exam by a doctor to diagnose the cause of the cough and prescribe a course of treatment. In the case of pertussis, prevention is the best strategy to avoid contracting the infection. A whooping cough vaccine is available and is recommended as part of a standard course of vaccinations in children. In South Africa, the vaccine is part of the normal vaccine regime for children. The next cough we look at is a barking or croup cough. A barking cough sounds like the barking of a dog. The barking sound results from inflammation of the upper airways, particularly the airways surrounding the larynx. A barking cough is also referred to as a croup cough because it is characteristic of croup. Croup is a viral infection that causes swelling around the bronchial tubes, trachea, and larynx. As a result, patients have difficulty breathing and develop a severe cough. The inflammation and cough may be so severe that the patient may gasp for air or even turn blue. Most patients recover from croup at home without medical treatment. But in severe cases, doctors prescribe anti-inflammatories such as steroids to reduce the swelling of the airways. The next cough we look at is a burning cough. If you experience burning in your throat or chest as a result of your cough, you may be coughing up stomach acid. This is a symptom of gastroesophageal reflux disease, also known as GERD. In GERD, the muscle at the base of the esophagus fails to seal stomach completely, thereby allowing stomach acid to flow up the esophagus. The stomach acid irritates the esophagus. This irritation is felt as a burning sensation and can trigger a cough that can push the stomach acid up the throat and into the mouth and nose. In severe cases of GERD, the irritation and cough may even trigger regurgitation or vomiting. Over-the-counter medications are available to control heartburn. Most of these medications are referred to as acid reducers because they reduce the volume of acid produced by the stomach. Additionally, antacids can neutralize the acid in the stomach so that the acid is less irritating to the esophagus. Serious cases of GERD that result in regurgitation or vomiting may require a visit to the doctor. The next cough we look at is called a phlegmy cough. Phlegm is slightly different from mucus. Mucus is produced by the body to protect tissue from foreign particles and disease-causing microbes and to prevent tissues from drying out. Phlegm is mucus that has done its job. That is, phlegm is mucus with foreign particles, microbes, and immune system cells embedded in it. Mucus is typically clear since it's composed primarily of water. Phlegm can take on many colors that can indicate what your body is battling. Yellow or green phlegm usually indicates a viral or bacterial infection. The color comes from white blood cells in the phlegm. Pink phlegm comes from fresh blood. Brown phlegm comes from old blood. And black phlegm usually results from particulates in your lungs from smoke or dust. A common cause of phlegmy coughs is bronchitis. Bronchitis is caused by an infection in the lungs. Although it is easy to read too much into the color of the phlegm, yellowish phlegm is usually suggestive of a viral infection, while green phlegm usually suggests that of a bacterial infection. In either case, bronchitis will often clear up on its own with proper home care, including drinking lots of fluids, using a humidifier, and taking expectorants to loosen and hydrate phlegm so that it can be coughed up. Lastly, we'll be looking at serious coughs. Now, some coughs signify serious problems and may require medical attention from a doctor. Some signs that a cough is serious include gasping or difficulty breathing, pale or blue skin from lack of oxygen, bloody mucus or phlegm, high or persistent fever, a cough that lasts longer than a few weeks, a whooping or wheezing sound, frothy pink phlegm, and persistent cough that interferes with sleep. While these symptoms do not necessarily mean that you are suffering from a serious illness, they sometimes accompany life-threatening conditions such as pneumonia, congestive heart failure, lung cancer, pulmonary embolism, or tuberculosis. Visiting a doctor for an examination and diagnosis can help to identify or eliminate these conditions. So guys, as you can see, different types of cough can signify different illnesses and conditions, as well as the seriousness of your illness or condition. Learning the differences can help you discern when you can treat your cough at home or require a visit to the doctor. Moreover, understanding and recognizing when a cough is serious can help you avoid a situation in which you miss the signs of a serious illness. If you guys enjoyed today's show, please hit the like button and please subscribe to the channel. For all your questions, leave them in the comment section below and I will get back to them. Thank you guys for joining me. Take care. Goodbye.